Okay. A few things about how we got to this point. And the first step in this process was really when the Center for Health Administration Studies, which most of you know is a venerable health policy and research center at the university, been around for 50 years at least, decided to support a big data research project of Dr. Kao-Ping Chua, who has just come to the university in the Department of Pediatrics. Do you want to say hello? To use a very important health policy data file, the Medicaid MAX data, that has claims for 20 million beneficiaries of Medicaid, which most of you know is our federal program for health care for the poor. And it became clear to those of us at CHAS that these big data and big data in health generally were very of great interest to a larger group of interdisciplinary faculty in the university, and that this represented a real opportunity for the university to become a hub or a center, an institutional expert for analyzing these important health policy data. They're important, of course, because of the recent passage of the Affordable Care Act, which is probably the major, one of the biggest policy changes in the U.S. since the Depression, since Roosevelt built our welfare system. So for addressing questions related to healthcare policy, utilization, expenditure, as well as disease prevalence, these data are really a remarkable opportunity. So I took this idea to then Provost Eric Isaacs, who shared my enthusiasm for the project, and he put me together with Ian Foster, and the result is this workshop. It's been really a wonderful pleasure to work with Ian to learn about the work of the Computational Institute and the faculty and fellows and the remarkable work they're doing in so many areas: biological and life sciences, culture and society, planet and the environment, the cosmos, as well as work on advanced computational analytics. So I'm extremely enthusiastic about the lineup of speakers we have this morning in your program. They're listed. I'm excited about all of you, the participants. And you will note that in your program, all participants, as well as speakers, are listed with email contacts deliberately so that you can stay in touch after the workshop. Basically, our goals are, Andre asked me, what are our goals for today? And they're threefold. The first is to broaden the way we think about interdisciplinary collaboration that's necessary to advance data science in the university, to build our on the multiple exciting ongoing data science projects in the university, and finally to stimulate new collaborations in health and health policy. So we're hoping that this is going to be a highly participatory day. Ian has insisted that we have plenty of time for discussion and questions. We have breaks, we have lunch, and we have a reception for follow-up questions. So I hope you will all be able to participate as much as possible in every aspect of the day. So with that, I will turn the microphone over to Ian, who is going to add his words of welcome, and he's going to be our speaker introducer, and I will be the timekeeper. There you go.
Thank you. Given what I know about some of our speakers, I think a timekeeper is probably a very important role. So, yeah, thanks everyone for being up so early. I was up late last night working on a presentation on empathy and rats with my daughter, who's spent the summer working in a lab, Peggy Mason's lab. So I now know a lot about rats, anatomy, what else? Empathy. And what? Empathy, yes, right. But anyway, so nevertheless, I managed to get up early. So yeah, Jean came to see me in my office a few months ago, and explained, what she and her colleagues were doing with this new data set. and asked what we might be able to do to help, or who she should talk to learn about various aspects of dealing with this sort of data set. And I sort of said, I don't know too much myself, but I have lots of friends who do. And so this led to, first of all, actually a lunch at the Quad Club where we had a very wide-ranging conversation, and then this workshop. So we really appreciate the people who've made the time to come, and we hope that it will lead to a really productive discussion on a number of levels. I think we all have perspectives on this question of how to address issues of health policy with the aid of new data sets. Perspectives at various levels. Some of us are concerned about the policy questions that need to be answered, the policy questions that perhaps can be answered now that could not be answered before. Others, perhaps more like myself, have perspectives on the sort of more mundane issues of, well, how do you actually manage these highly sensitive data sets? How do you bring together sensitive data sets from different sources and turn them into community resources while nevertheless preserving the privacy and the confidentiality that's so important when dealing with this sort of data. So we hope that we'll have a conversation that ranges across these different levels and leads to new knowledge in all of these spaces. So that's all I'm going to say in terms of introduction. I'm now going to introduce our first speaker, Dr. Silverstein, who I was told I should tell stories about each person, but I know so many about Jonathan, I'm not sure where to begin. So no, Jonathan is a very distinguished researcher and physician, so I'm told that it's not good to rely on your surgical skills anymore. Is that true? Yeah, right. But anyway, a researcher with this wonderful background in a practicing physician in the past, and then very deep knowledge of informatics at various levels. I first met him actually when he was engaged in applying virtual reality techniques for surgical training at the University of Chicago. And then when I took on the Computation Institute and I wanted someone to help me understand how to talk to people in the biological sciences division, I engaged him as my associate director, which was a very fruitful conversation. He's since then left us to run a really exciting group at North Shore Hospital, where he's been applying many of the things we talked about at the University of Chicago on very large scales. And yet more recently, he may or may not tell us about some new adventures he's engaged in. But anyway, we're very pleased to have you here, Jonathan, to tell us about, I don't have my program, so I don't know the title of your talk, but you'll tell us. Okay, good.